In a world where the importance of sleep and airway health for kids is gaining so much momentum, we're here to provide you with a clear pathway through the maze of information. Join us as we connect with experts, share real-life stories, and break down the complexities that surround this critical issue. From screening techniques to collaboration with our medical colleagues, we're here to empower you with actionable insights and a supportive community. Let's navigate the path together to healthier sleep, brighter futures, and happier families. This is ASAP Pathway. Hi, everybody. Welcome back to another episode of the ASAP Pathway podcast. I'm excited today about this topic, about who is taking time to speak with us today. And I get to have my partner in crime, Dr. Tracy, with me today. So it's kind of unique when we can jump on together. Today, we have Dr. Nathan Bryan, and I'd love to introduce you to him. This is a very abbreviated bio, quite accomplished, been a busy man. So without further ado, I'd love to introduce you all to him and dive into this awesome topic. Dr. Bryan earned his undergraduate Bachelor of Science degree in biochemistry from the University of Texas at Austin and his doctoral degree from Louisiana State University School of Medicine in Shreveport, where he was the recipient of the Dean's Award for Excellence in Research. He pursued his postdoctoral training as a Kirstein Fellow at Boston University School of Medicine in the Whitaker Cardiovascular Institute. After a 2-year postdoctoral fellowship in 2006, he was recruited to join the faculty at the University of Texas Health Science Center at Houston by Farid Murad. Did I say that right? Farid Murad?
Farid Murad, yeah.
Farid Murad, Ph.D., 1998 Nobel laureate in medicine and physiology. Dr. Bryan has been involved in nitric oxide research for the past 20 years and has made many seminal discoveries in the field. His many seminal discoveries have resulted in dozens of issued U.S. and international patents, and the product technology resulting from his discoveries and inventions has improved patient care worldwide. He is a successful entrepreneur and founder, chairman, and CEO of Bryan Therapeutics, Inc., a privately held clinical stage biotechnology company that is actively engaged in the discovery and development of nitric oxide-based therapies. BTI has active drug development programs in heart disease, Alzheimer's disease, and topical drugs for diabetic ulcer and non-healing wounds. He's an international leader in molecular medicine and in nitric oxide biochemistry. Without further ado, welcome.
Well, thank you so much. Good morning. It's great to be with you. Good to
I'm
see
so
you.
excited. How in the world? Okay, obviously research is a passion of yours. Why not? What happened that nitric oxide became so heavy on your radar?
Just like anything, I think it was timing. When I was a student at University of Texas and pursuing my degree in biochemistry, I had the very fortunate opportunity to do undergraduate research. And that was really the introduction to me to the basic sciences, and really the complete intellectual freedom really attracted me to that. And so in the fact that you could ask any important biological question and then set up an experiment to answer that question gives you complete intellectual freedom. And then when I went to LSU School of Medicine, a Nobel Prize had just been awarded for the discovery of nitric oxide. And, just coincidentally, Lou Ignarro, one of the guys who shared the Nobel Prize, came to LSU Medical School and gave a lecture before the student body. And this was an exciting time, a Nobel Prize, which is only awarded for discoveries that change mankind, right? That's how, and it's the highest accolade that you can get in science and medicine. And so I had a very fortunate opportunity to have a conversation with him. And he was like, Nathan, he goes, look, this is such an important molecule. It's a gas. It regulates important things like blood flow, oxygenation. But he goes, if somebody could ever figure out how to safely and effectively deliver nitric oxide to patients, it'll change the world and it'll change the landscape of medicine. And so that was a pretty profound statement for me. And then, I trained under Martin Felish, who was a pharmacologist and had been in the nitric oxide field for the previous 20 years. And so that was really what got me started in the field. It was the curiosity, it was the promise of, a life-changing kind of a field of study. And so here we are 25 years later, and we've come a long way. We've made a lot of progress, but there's still a lot of work to be done.
Well, in our field, in dental sleep medicine, the topic of nitric oxide is discussed. A lot of people don't understand, how it exists within the paranasal sinuses, the importance of
Yeah.
nasal breathing, the relaxation of smooth muscle. It helps with oxygenation. It helps with zapping the pathogens. So, from a dental sleep medicine, airway perspective, we've had nitric oxide discussions, and even like I remember during COVID, there were a lot of discussions of, oh my goodness, the importance of like, we want to get that nasal breathing, we want to get as much nitric oxide, and what it was showing with the effects of COVID-19 and nitric oxide and was a game changer. And I see that was something that, you're developing products to help with wound care, cardiovascular health, but even you have, the fight against COVID-19. You
Right.
guys were working towards that. For the audience, we have all kinds of people listening, backgrounds. We have healthcare providers, we have patients, parents, everyday people.
Sure.
How would you describe the importance of nitric oxide in the body? This gas, this molecule, under discussed molecule.
Yeah, well, it's fundamental, it's foundational, and it's really the key to longevity and health and well-being because all the things you mentioned, whether it's nasal breathing and tissue oxygenation and regulation of blood flow, all is determined by the body's ability to produce nitric oxide. And during COVID, the problem was the hypoxemia, the lack of tissue oxygenation and loss of blood oxygen saturation, which eventually led to hospitalization of patients. And they put them on 100% oxygen. They didn't get better. Patients were put on a mechanical vent, and many people died unnecessarily because the problem was you're not really out of oxygen. You've lost the ability to take up oxygen and deliver oxygen. And all of that is predicated on the ability to produce nitric oxide. And so the people who got sick and died from COVID were the people who could not make nitric oxide. These were the elderly, the hypertensive, the diabetics, people with previous heart attacks, African Americans. So the common denominator in all of that high risk susceptible patient population was endothelial dysfunction and nitric oxide deficiency. So we had a drug in phase 3 clinical trials as an early therapeutic for COVID. And what we were finding was if we could catch these patients early on and give them a nitric oxide delivery, which is what we do, then we could improve tissue oxygenation. We could keep patients out of the hospital. And it was our thought that if you can keep patients out of the hospital, you can keep them alive and allow them to recover. But COVID, looking back, it was a moving target, a lot of politics around that. And so we just the disease changed, the variants changed, people weren't going to the hospital, and we eventually abandoned the drug study. But the data, what the data, we learned a lot from that study. Number one, that the drug and the way we deliver nitric oxide is extremely safe. There was not a single safety signal in the more than 500 patients that we treated with our active drug. So safety has been very well established, and we saw that we could improve tissue oxygenation. We saw a statistically significant improvement in the time of disease and the onset of symptoms. So nitric oxide is the key, I think, to any respiratory illness, and it all is, dependent upon the body's ability to produce nitric oxide or to give nitric oxide. So you can dilate the pulmonary arteries, you can shut down virus replication, you can improve tissue oxygenation, and overcome all these symptoms that we get from respiratory viruses.
What is the most effective way to deliver nitric oxide? I guess this is a two-part question. And then how quickly, man, this could be a five-part question. Anyway, let me just stick with this. What is the most effective way to deliver nitric oxide? And then, how quickly is that uptake evident in the body?
Well, as nitric oxide is a gas, right? So the most effective way to deliver it is through a nasal cannula, similar to oxygen. And this technology has been used, in fact, it's only approved in pediatric medicine. And the only FDA approval for nitric oxide is inhalative nitric oxide therapy for premature babies with pulmonary hypertension. So this is in critical care medicine, neonates. And as you guys know, the lungs are typically the last to develop. So when babies are premature, they have underdeveloped lungs.
Mhm.
And the lungs have this phenomenon called hypoxic vasoconstriction. So if you have underdeveloped lungs and you can't fully oxygenate, the blood supply, the body naturally shuts down blood supply to poorly oxygenated regions of the lungs. So you get this mismatch in ventilation to perfusion. So they found back in the 1980s, early 90s, that if you delivered nitric oxide gas to these premature babies, you could dilate the pulmonary arteries, you could dilate the bronchioles, and you could match ventilation to perfusion, overcome the pulmonary hypertension. And it saves the blue baby syndrome, right? The cyanotic babies from poor oxygenation. So that technology told us, more than 40 years ago now that nitric oxide is extremely important. But the only way to deliver it was through a nasal cannula in an inpatient setting. So what I've been trying to do for the past 25 years is how do we safely and effectively deliver nitric oxide gas, therapeutic levels, in an outpatient setting? How do we deliver this in a solid dose form? And that's kind of the riddle that I solved many years ago.
Well, is that the lozenge form that
That's
you
the
have?
lozenge. So we make an orally disintegrating tablet that as it's slowly dissolving in the mouth, that it's releasing therapeutic amounts. In fact, similar amounts of nitric oxide that they deliver therapeutically in the neonatal intensive care unit. So when we deliver a specific amount of nitric oxide over a very specific period of time, so that I designed that lozenge to have a very specific dissolution rate that we could quantify and detect and predict the nitric oxide that we're releasing in every single patient.
And for those of you listening, we're going to have links for the products that Dr. Bryan has invented. The lozenge in particular, it's N101 or N101.com.
Yeah.
Yeah, for nitric oxide for the lozenge. And then there's also Dr. NathanSBryan.com, BryanTherapeutics.com. So I'll have all these links, and then we'll go into some other amazing things that you've got coming out too at the end of February that are it's really exciting as well. What have you gotten what are your biggest obstacles in discussing nitric oxide?
Oh, geez. Where do I start? Here's what I find that if you're doing something that's meaningful and life-changing, there's a lot of, opposition. And there's a quote that I love from, 400 years ago by Schopenhauer. He was a German philosopher, and he said that fundamental truths go through three phases. First, they're ridiculed. Secondly, they're violently opposed. But third, they're accepted as being self-evident. And I've experienced this as you go through kind of these fundamental truths around nitric oxide. Certainly there was ridicule. When I first launched this technology years ago, I was ridiculed by my academic colleagues. And then, there's violent opposition to what we're doing. This is very disruptive technology. And so the biggest hurdles I have today, it's really differentiating what we do as a company and the science and innovations that we bring forward. How do we differentiate that from all the other dozens or hundreds of so-called nitric oxide products on the market? Because in 98, after the Nobel Prize was awarded, the market was flooded with L-arginine-based nitric oxide for pre-workout, for pump, for these muscle heads. And now, if you just Google nitric oxide, the first page of Google is, for sexual function and all these supplements. And, just based on the underlying biochemistry and human physiology, if people understood that, they would know that these products don't work. They can't work just because of the problems that lead to nitric oxide deficiency. So in order to overcome that, I trademarked a term called nutraceuticals. Everybody knows what nutraceuticals are. They're things like vitamin C, vitamin D that are meant to supplement missing nutrients. And so all these other nitric oxide products are, in the nutraceutical dietary supplement space. But my products produce nitric oxide that we can quantify, we can detect, we can verify coming off these products. We can see the improvements in patients once they take them. So we try to differentiate that and coined a term called nutraceuticals. And it's trademark. And that's what we do. And that's what differentiates us. And we do it in our topical nitric oxide serum. We do it through our lozenge. We make a fermented beet powder that produces nitric oxide as soon as it hits solution. So you mix it in water, mix it up, and take it as a shot, and it's immediate onset.
Why are we why are we seeing such nitric oxide deficiency? So our body makes nitric oxide. It's, resident in the endothelial cells.
Yep.
Why are we not making enough? What are the things that are causing our bodies to be so insufficient or so poor in nitric oxide production?
Well, we know that now, and I think before we started, we could answer that question. The first question we had to answer was, how does the human body make nitric oxide? Because until we had a full understanding of the enzymatic and natural production pathways, then you can start interrogating, okay, what's disrupting this pathway? So there's an enzyme in the endothelium, in the epithelium, called nitric oxide synthase. And this enzyme was really discovered back in the 80s. And this enzyme converts arginine into nitric oxide and makes citrulline as a byproduct. But this enzyme is a very energetically and kinetically unfavorable reaction. It's what we call a 5-electron oxidation reaction. And so things like oxidative stress, things like a poor diet, high glycemic, high sugar diet, all render this enzyme dysfunctional. And we call this endothelial dysfunction. So as long as this enzyme is coupled and functional, when we exercise, when we do nasal breathing, deep breathing, that activates this enzyme and it produces nitric oxide. But when the enzyme becomes dysfunctional and uncoupled, even if we do deep breathing, even if we try to activate and stimulate the production of nitric oxide, it doesn't work. And so the other pathway we first started discovering probably 20 years ago was the role of the oral microbiome. And so this is where dental medicine is foundational for human health, because whether it's airway, whether it's managing the oral microbiome and optimal, oral health, all of that leads to optimal nitric oxide production. And when you start disrupting that, you completely destroy nitric oxide production. So to answer your question, what causes disruption of the enzyme in the epithelium and in the endothelium? It's the Western diet, Western lifestyle. It's things like proton pump inhibitors and antacids. What disrupts the oral pathway? It's antiseptics, fluoride rinses, fluoride in your toothpaste, use of chlorhexidine, use of Listerine, scope, anything that's antibacterial. It's destroying the oral microbiome, and part of these bacteria are responsible for producing nitric oxide, and that shuts down nitric oxide production.
We're seeing this topic on just the microbiome in general being discussed so much more, and awareness being raised. And I say this a lot when we're talking about sleep health, things beyond the anatomy of the airway, more of the neurological aspects of the collapse of the airway, the function of the airway, and what is changing their neurology. And we're seeing more and more the impact of the biome in the body, the microbiome, the gut health. But I feel like even the oral microbiome is behind the gut microbiome in discussion, and you're starting to see it emerge. And I was shocked just some of the things I'm seeing with some of the things as dentists that we promote so much for oral health is probably one of the biggest disruptors of the oral microbiome.
Yeah.
And so, like you said, things like Listerine, chlorhexidine, fluoride, and maybe this, I don't know if you can speak to this topic, what are substitutes that could help build up the oral microbiome to help with that nitric oxide production? Do you have any information on that would be beneficial?
Yeah, no, we do. And I've been trying to work on this for the past probably 10 or 15 years once we understood the critical role of the oral microbiome. And this started probably 15 years ago with some early data. We and others had published that, if you just use mouthwash and you take patients that use mouthwash, and 2 out of 3 Americans wake up every morning and use mouthwash. And so we did some controlled experiments just to see what the effect of mouthwash was. And if you take normal intensive patients and you give them mouthwash twice a day for 7 days, we see an increase in their blood pressure. I mean, and that was shocking. That's a completely new paradigm in the regulation of systemic blood pressure. So we've known about the oral systemic link, right? For more than 100 years now, that people with poor oral health have a higher incidence of, heart attack, stroke, really all-cause mortality. And it was recognized that the pathogenic bacteria in the mouth, bleeding gums, periodontal disease, gingivitis, there's translocation, causes inflammation. And you can detect oral pathogens in the thrombus of people who have died from sudden cardiac death from
Yeah.
acute MI. And so that was the oral systemic link. And so the remedy was, well, let's give an antiseptic. Well, think back 100 years ago, we had no idea about the microbiome. Today, we know that the bacteria that live in and on our body outnumber our human cells 10 to 1. And, just like any GI doc will tell you, you cannot take an antibiotic every day for the rest of your life because it destroys the gut microbiome and it causes systemic disease. So, by the same argument, why would you use an oral antiseptic every day for the rest of your life to destroy the oral pathogens or the oral microbiome and all the pathogens, the non-pathogenic commensals? And there's consequences to that. Your blood pressure goes up, you lose the protective benefits of exercise, and it's just a bad idea. So to answer your question, how do we, and I started speaking at dental events probably 10 or 15 years ago because there was a huge connection. And to me, it made perfect sense. It was the mechanism of action for the oral systemic link. So we understand there are pathogens that we must mitigate and control in dental medicine. But we also don't want to have the collateral damage of just wiping out everything and throwing an atomic bomb in the mouth like chlorhexidine is and completely destroying the microbiome. So here's what we've learned over the past 10 years in research, that pathogenic bacteria are typically sensitive to nitric oxide. The nitric oxide that's produced binds to the iron sulfur centers and shuts down their respiration and kills those. The non-pathogenic commensal bacteria are nitric oxide producing bacteria. So if we can create nitric oxide or create an environment of nitric oxide in the oral cavity, you're selectively killing the pathogens and you're improving the diversity of the non-pathogenic commensals. So we can do this through the lozenge. And we've developed a toothpaste, a nitric oxide biome-friendly toothpaste that we're going to be launching probably in the next 4 to 6 weeks. We've eliminated fluoride. We're putting, hydroxyapatite in there with electrolytes. We're adjusting the pH of the oral cavity, and the salivary pH and is extremely important in how we maintain an optimal microbiome. And then, I'm not a big fan of mouth rinses, but I understand, it can be effective, and 2 out of 3 Americans use it. People want fresh breath, so I developed a nitric oxide friendly mouth rinse that we'll be launching probably at the end of March or April. And what we're finding is that we can actually improve, we completely change the diversity and improve the diversity of the oral microbiome. And so I'm excited about that but 15 years ago, we published that if you use mouthwash and you destroy the oral microbiome, your blood pressure goes up. So now we're getting some early data now that if you get rid of fluoride and you just change out fluorinated toothpaste with our new toothpaste and then use our mouth rinse, can we take resistant hypertensive patients? These are patients that are resistant to antihypertensive therapy. And simply by using our toothpaste and our mouth rinse, we can normalize their blood pressure because we're restoring a natural production of nitric oxide that's now normalizing blood pressure. And 50% of patients that are on antihypertensive therapy are resistant to that therapy. And the reason they're resistant to that is because, it's not a renin-angiotensin problem. So ACE inhibitors and ARBs aren't going to lower their blood pressure. It's not a dysregulation of calcium. So calcium channel antagonists aren't lowering their blood pressure. The hypertension is a symptom of that oral dysbiosis. So if we can restore that, we can restore normal blood pressure. And I'm pretty confident and believe that that's going to change the whole landscape of medicine because hypertension is the number one risk factor for the number one killer, cardiovascular disease.
Trace, this is when, and this oral connection that he's, in speaking to the dental community now, that's how you first learned about Dr. Bryan was at the ADA. He spoke at the American Dental Association when you were there speaking. And I was telling him that you came back and you're like, oh my gosh, you've got to get this guy on. You've got to talk to him. It's amazing. I really do feel just with everything that's happening, the airway connection, craniofacial development, dental sleep medicine have been partnering for decades. But it's a shame. We used to see that the mouth was connected to the body. If you look at just look at literature over 100 years ago.
Yeah.
But there's just been such a disconnect. And I really feel that there is going to be this kind of awakening of, let's quit compartmentalizing things. We have to start collaborating and communicating as healthcare providers to help our patients sitting in front of us. I think we're going to
Yeah.
see some huge collaboration with oral systemic health. It's starting to happen, not as fast as it should, but hopefully with what you're talking about. This leads me to just even the cardiovascular, probably one of my biggest referrals. I get a lot from ENTs, and I
Yeah.
get a lot of referrals from, the cardiovascular world, whether it's, a cardiologist, a surgeon, what have you. Those are the two that seem to collaborate the most with us right now. So let's go to cardiovascular health. Something I saw a phrase that you had said. You said most, if not all, chronic diseases, including cardiovascular disease, are characterized and caused by the loss of nitric oxide production. What are some of the things that you are seeing change or happen when you take somebody? I mean, you just mentioned someone that doesn't have any issues. You change the microbiome and oral microbiome, and oh my goodness, we're seeing high blood pressure induced, which is
Yeah.
crazy. But what are you seeing in patients that are already diagnosed with disease? They're already, they're past that on the edge, they're full blown in disease state. What are you seeing when you introduce nitric oxide therapies to these patients? And how quick does
You
it
know, it's
happen?
no, it's life changing, and that's one of the kind of the most gratifying things that I do is waking up every morning and getting emails and texts from people that we've changed their lives. And just last week, I got this one, a guy posted it on my YouTube channel, and he suffered for 30 years with resistant hypertension, ED, mild cognitive disorders, brain fog. And he started taking the lozenge. He said within 2 days, his blood pressure normalized. Within, I think, 2 weeks, he was starting to wean off his antihypertensive therapy. He had more energy. His sexual function was improving. And that's just one of, hundreds. And then in 2011, we published on a 15-year-old kid in pediatrics, obviously with what you guys specialize in, with a rare genetic disorder. He had, resistant hypertension for 10 years, severe heart disease, kidney disease, and he was resistant to all prescription medication. And when we saw him at Texas Children's Hospital, he was in the pediatric intensive care unit with a blood pressure of 210 over 115.
Oh my
And he
gosh.
was on 4 different antihypertensive medications. So obviously, this was a critical situation and high risk of stroke and many critical medical issues. And so we just started dosing him with our lozenge, the nitric oxide releasing lozenge. And for me, that was the most daunting kind of experience I've ever had, because I was in the room with his pediatrician, his geneticist, the pediatric cardiologist, the pediatric nephrologist, and they kind of looked at me half joking. They go, "What is this lozenge going to do? We're the best of the best at Texas Children's Hospital, and we can't figure this out." And so we were in the room with him. We took his blood pressure. We gave him the lozenge. 20 minutes later, his blood pressure came down to 180 over 100. 2 hours later, his blood pressure was 140 over 85. 4 hours later, his blood pressure was 130 over 80. And they couldn't believe it. And we sent the kid home with the lozenge. We were dosing him once every 4 hours. And within 5 days, his kidney disease resolved. He was no longer spilling protein in the urine. And within 5 months, he had severe left ventricular hypertrophy, a heart twice the size of a normal 15-year-old.
Hmm.
And within 5 months, his heart had completely remodeled and normal function, normal size. Echo was completely normal. We got him off all prescription medication. His cognition improved. He started beating his dad at chess.
Aw.
We published this in the American Journal of Human Genetics in, I think, 2011. So those were really the eye-opening for me, and that's just two examples out of hundreds, maybe thousands now.
Do you feel the medical community, well, You kind of just said it when you walked in the room. They're like, okay, what do you got that we don't have? Um, but do you feel that this is going to become a more accepted therapy? Do you feel that this is something that the medical community is becoming more open to?
Well, I think, conventional medicine is a system, right? And it's a business. And so everything is predicated on how do you make a diagnosis? How do you bill this? How do you code it? And then once you code it and make a diagnosis, you're left with finite responses to how you can treat that patient. And that's the so-called standard of care. And so most allopathic physicians don't use supplements as part of their therapeutic armament. And I think rightfully so, because there's so many products on the market that are dietary supplements that don't do what they're advertised to do. And the nitric oxide market is replete with products that will not deliver. So what we're doing, and I never intended to develop a nitric oxide supplement. I'm trained as a drug discovery chemist. That's what we do in academia. I spent, 15 years in academia trying to develop safe and effective drug therapy. So we're moving down that path. And I think once we get our nitric oxide drugs approved through the FDA, and now physicians can have confidence that it's gone through the rigor of drug studies and approval by the FDA and their safety established, I think then it will become the mainstay of modern medicine. And I think it's going to be how we treat patients for the next 100 years. And that's why I'm excited about our ischemic heart disease drug study. We've got a drug for Alzheimer's.
Yeah.
Nitric oxide will, I think, completely eradicate Alzheimer's, because if you look at Alzheimer's, there's four hallmarks of that. There's low blood flow. It's called focal ischemia. There's a loss of regulation of blood flow to certain regions of the brain. There's inflammation, oxidative stress, immune dysfunction, and there's insulin resistance. So there's five hallmarks of Alzheimer's. So if we just give nitric oxide, we can see through PET scans or functional MRIs, we can improve cerebral perfusion. And then in 2009, we published that nitric oxide is part of the insulin signaling pathway, so we can enhance glucose uptake. So we overcome the metabolic disease and the metabolic phenotype of Alzheimer's, and we reduce inflammation. Several of my patents are on a method of reducing inflammation by nitric oxide. We shut down oxidative stress. We eliminate the immune dysfunction. And if you can get blood and oxygen and blood flow to the brain and take out the metabolic waste products, proteins don't misfold. There's no tau tangles, there's no amyloid plaque. So we can address the fundamentals of Alzheimer's simply by restoring the production of nitric oxide. So yeah, I think it'll be the way we treat patients for the next 100 years.
So we discussed the connection between making the good guys, the good bugs. If you provide nitric oxide in the oral microbiome, you inadvertently wind up wiping out the pathogenic ones, and you provide an environment for the good ones to flourish. Is it the same in the gut? Are you seeing the same thing in the gut, or is it just more local because the nitric oxide is an oral lozenge?
Well, as we all know, the microbiome completely changes from the mouth to the anus, right? That's the outside world. There's this tube that goes from our mouth to our anus, and it's the outside world. And the role of that is to bring the good stuff in and keep the bad stuff out. So if we have dysbiosis, we get leaky gut, we get all these GI problems. And so what we focused on, and the gut microbiome, I think, was the first to be completely mapped. And the oral microbiome had kind of been ignored until we and others started working on this and trying to make a connection between nitric oxide production. But yeah, so I think once we understand that, and there's biofilms, and we published, I think, this in 2014, 2015, and from tongue scrapings of individuals and doing salivary testing and figuring out, okay, the people with the greatest diversity of the oral microbiome had the best management of blood pressure and seemed to have overall better systemic health. When you lose that diversity because of mouthwash, because of poor oral hygiene, because of many different confounding factors, then those people seem to be metabolically challenged, higher blood pressure. And so that was our first kind of association, right? But association is not causation. And then when we did a controlled study, we established causation because we took normotensive patients, we gave them mouthwash and made them hypertensive.
Jeez.
Didn't change their diet. They weren't on any drug therapy, but we could make people clinically hypertensive simply by eradicating the oral microbiome. And that is causation.
So when you mentioned the pediatric patient and you were dosing every 4 hours, a couple of questions there. Are there are there pediatric and adult dosing, or is everybody kind of the same when it comes to the therapeutics of nitric oxide?
Well, it's based on body weight. Obviously, for any dosing, we have to look at pharmacodynamics and pharmacokinetics of whatever we're delivering. But this 15-year-old probably weighed 160 pounds, so he was an adult weight. But in, pediatrics, my kids have kind of been, my dad and my kids and my family have always been the guinea pig, right? Because
I
if
get that.
I'm going to do, and I'm the N equal one guinea pig from early on. But, so what we try to say is like one lozenge would be like for a 100-pound person. So if you've got a 50-pound kid, you would break the lozenge in half. If you got a 20 or 30-pound kid, then break it in a quarter. But dose dictates toxicity, right? So in this 15-year-old kid, we had to monitor him. And the only signs of toxicity for nitric oxide are low blood pressure, what we call hypotension, and a condition called methemoglobinemia. And so we would draw blood periodically in this patient. We were dosing and monitor his met levels. And even at one lozenge every 4 hours, there was no change in the methemoglobin levels in this 15-year-old pediatric patient. So we feel good about that. And even in the COVID patients where we dosed, over 500 really sick patients, some of these patients were on 12, 15, 18 different prescription medications. And even in that polypharmacy environment, there was no safety signal, no unsafe drop in blood pressure, no first dose effect, no methemoglobin formation. And so the nitric oxide that we're delivering through this delivery system, whether it's in supplement form or drug therapy, is extremely safe. And that is really the first hurdle because, as you guys know, prescription drugs that have gone through the rigor of safety and efficacy through the FDA, are the third leading cause of death in the US.
Yeah, the side effects of all the medications, and you put them on more medications to manage the side effects, and these people are
Vicious cycle.
It's a vicious cycle. They're miserable. I mean, we deal with it in our practice. I'll see a list of medications, and they'll have dry mouth, and they're miserable, and it's like you don't want to put them on another medication to manage the dry mouth, and now they're on another. I mean, it's definitely a pharmaceutical driven industry, unfortunately. Like I've talked to a few physicians on the podcast, and if they could, they're saying, the culture of med school, it's not really getting to the bottom of things. It's more of how do we manage the symptoms with pharmaceuticals.
Yeah,
and if we can change the culture of med school and have, and dental school, and just have more doctors emerging with a different mindset than kind of symptomology, pharmaceutical led thinking, we would have a whole new paradigm shift.
for sure.
And
I taught in medical school for a number of years. And the frustration was, you learned the first 2 years, you're learning, your biochemistry, anatomy, physiology, pathology. But then once they go to clinic and learn ICD-10 codes and diagnosis and standard of care and pharmacology, then, you forget about basic mechanisms and understanding root cause. And, medicine's a business. And once I had that epiphany, because I try to think, the basic science doesn't translate into clinical care. And why is that? Because medicine, unfortunately, is not this altruistic kind of practice on do what's best for the patient. It's a business. It's a for-profit business. In fact, one of the most successful in the history of the world. It's $1 trillion global annualized business. And as a business owner and a founder and an entrepreneur, any for-profit business, it's how do we get a customer and how do we maintain a customer? And medicine is the best business model for that, because once you get a customer, you keep that customer for life, and now you get them on more medication to mitigate the effects of the previous medication. And it's the best business model out there, but it's not in the best interest of the patient and making the patient better, because, America prescribes 60% of the world's drugs, and we're only 4% of the population. And yet we have the sickest population on earth. So those data right there tell us that prescription medication is not making anybody better. In fact, it's making us sicker. So we have to address root cause. We have to understand the oral systemic link. fix anatomical issues that are obstructing airway and oxygenation, restore nitric oxide production so you can maintain vascular health, you can maintain tissue oxygenation, and reduce inflammation. And when you do that, it transformed the way you look at disease and treat disease.
Trace, this has got me thinking too, just, well, something he said, part of therapeutics, even for what we're doing, craniofacial intervention, evaluation, development. Tracy gets a lot of referrals from ENTs that are like, hey, sleep physicians, help me with this kiddo. They're CPAP intolerant. Um, I know it's got my brain going now about just in sleep apnea in general and the connection with nitric oxide and the whole cycle of breathing and um, PCRIT and all the different biochemical aspects of why an airway would shut down beyond anatomy.
So Nathan, how do you measure nitric oxide deficiency? I mean, because I think the thing is like now with all of these, with these meds on the market, people are saying you need vitamin D, you need magnesium, you need this. And so what we're finding is we're finding an error of patients seeking their own therapy. But at the same time, there, we have to understand that there's an efficacy rate and then there's a toxicity rate. So for the average patient that's listening to this, what are signs? One, what are signs of nitric oxide deficiency? How do you measure it? And then if a patient is self-prescribing them, like what's considered safe, and how should they continue to measure it monthly?
Yeah, it's been a challenge for us for the past 25 years because it's not like, blood draws like for vitamin D or triglycerides or things or magnesium where you can draw blood and get your number to optimum because nitric oxide's a gas. Once it's produced, it's gone in less than a second. Now we've kind of created a kind of a fingerprint of NO-biology that we used in the research lab. We could draw blood, we could sample saliva, and we could look at these metabolites of nitric oxide, but it's not used in clinical care. Really, the only way to measure nitric oxide is there's a couple of functional medical devices that measure endothelial function. We do this through what's called flow-mediated dilatation, venous occlusion plethysmography. But there's very few physicians in clinics that utilize these. So about 15 years ago, I developed a salivary test where we were measuring saliva on a test strip.
Yeah, I remember doing that. Yeah.
Yeah, and I think it's kind of a good tool to have in your toolbox. But what we found primarily from the dental community was that people were clinically nitric oxide deficient, hypertensive, diabetic, exercise intolerant, erectile dysfunction, and yet they would use this saliva test strip and they would light it up to where we would call optimal. And so we go, well, that can't be. And what we found was that they had an active oral infection, whether it was symptomatic or asymptomatic. So what we were picking up in the saliva was a local immune response in the gingival tissue, in the jaw, from the immune system, and it completely disconnect from systemic health. So I've gotten away from those test strips, and now we just rely on symptoms. So there's a hierarchy of symptoms that develop when you lose the ability to produce nitric oxide. The first one is usually sexual dysfunction, because understand that for men and women to get an erection, we have to dilate the blood vessels of the sex organs, and that's done through the production of nitric oxide. So if you have endothelial dysfunction and you can't dilate the blood vessels of the penis or the clitoris, then you have sexual dysfunction. You don't get engorgement. So that's number one. Number two is you start to see an increase in your blood pressure. Because nitric oxide is a vasodilator and dilates the blood vessels, when you lose the ability to produce it, now you've got constricted blood vessels. And now you're pumping the same volume of blood through smaller pipes, and through basic physics, your blood pressure goes up. And 2 out of 3 Americans have an unsafe elevation in blood pressure. Number 3, you start to develop metabolic disease because, as I mentioned, we published that nitric oxide is part of insulin signaling and glucose uptake. If the cell can't make nitric oxide, you develop insulin resistance. And 9 out of 10 Americans are metabolically unfit. Number 4, you start to develop exercise intolerance. If you can't walk up a flight of steps or walk across the room without getting short of breath, and it tells us you're not able to dilate the coronary arteries to meet the increased metabolic demands on the heart. And then number 5 is dementia and Alzheimer's. Because if you can't regulate blood flow to the brain, you can't oxygenate, you get protein misfolding, you get insulin resistance, and that's Alzheimer's.
So as a dentist, would I be outside of my scope as if I like see a patient with all these, the medical history just lights up and, and you said that you feel like these strips aren't working. So how would I recommend this product or even sell this product in the office? Because I mean, there's obviously tons of literature to prove the benefits, but as a dentist, how can I, from the scope of practice standpoint, what would help me to encourage my patients to take nitric oxide?
Well, there's only two patients who need nitric oxide. So if you have those patients in your office, then you would you would recommend it. And those two patients are people that are sick and want to get well, and the other patient is the patients who are well and don't want to get sick. So if those patients come into your office, then I think it makes perfect sense. I mean, I've been taking my product or early types of prototypes of my product for probably 25 years or longer. And I'm 50, I turned 51 last year, but I've got the biological and the vascular age of a 30-something-year-old. And so I don't take nitric oxide because I need it. I take it because I don't want to need it. And I
Right.
don't want to lose the ability to produce it. And we live in a toxic world where I'm on an airplane every week. I travel
Mm.
150,000 air miles every year, and I'm in different parts of the world. I'm traveling. It's very stressful. And even though I try to maintain a healthy lifestyle and exercise every day and eat a balanced diet in moderation, it's just we're compromising our ability to produce nitric oxide because of the world we live in and all the toxicity. So I take it as prophylactics, as a preventative and being proactive because I don't want to have to be reactive and respond once, and medicine is fear-based, right? People don't
Right.
want to make changes until there's a crisis. And once you have a heart attack or stroke or have some health crisis, you're reactive. And so what I'm trying to do is get this message out there, bring awareness around this so people can be proactive. And now we can empower the patient to take control of their own health, understand the connection between oral hygiene and systemic health, the oral systemic link, understand the importance of airway and full oxygenation and nasal breathing and maintaining an healthy oral microbiome and normal salivary pH, and that completely changes the microbiome. And mouth breathers have horrible oral hygiene, and their microbiome is completely different from those of us who are nasal breathers.
Yeah. So the recommended dosage for adults is one lozenge a day, right? And for children, what was the recommendation?
It's everybody's different. For me, what we tried to do when I developed this technology was, number one, I wanted to know how much nitric oxide does a normal healthy person make in 24 hours,
Yes.
both pathways. And so through radio labeled isotope labeling, we can determine that. Through dietary influence, we can determine that. So my goal was restorative physiology. So similar to vitamin D. If you've got a vitamin D of 20, let's titrate and dose to get it to 80, right? And so everybody's different, depends upon your starting point. But the whole philosophy was one lozenge will provide you what the body would normally produce in a 24-hour period based on normal enzymatic function, normal dietary patterns, normal oral hygiene, and normal stomach acid production. So for me, I take one lozenge twice a day, typically just for maintenance.
Got
But,
it.
like that 15-year-old kid, that wasn't sufficient for him because he had a very rare genetic disorder that completely rendered him nitric oxide deficient. So to titrate in a dose that managed his blood pressure, which was our primary endpoint, it was one lozenge every 4 hours. So everybody's different.
It
And can
sounds to
you
me, oh, sorry, Trace, go ahead.
can you take too much? Their
Yes.
toxicity level, yeah.
Yeah,
Mhm.
you can drink too much water. You hear it on the news all the time. People drink a
Right.
gallon of water over a short period of time. They get hypotonic lysis of cells and
Yeah.
die. I mean, the most fundamental things on earth are toxic. Water, for example. So yeah, you can take too much nitric oxide, and if you put several lozenges, 5 or 6 lozenges in your mouth at one time, I can't promise you you're not going to get orthostatic hypotension and
Yeah.
syncope and pass out. From
Yeah.
an unsafe drop in blood pressure and loss of perfusion pressure and things like that. But when used as instructed and indicated, it's completely safe. And we've demonstrated this in randomized placebo-controlled clinical trials.
Stace, at the ADA, I mean, Nathan gave such an amazing lecture that, like, when he was done, everybody went to the booth.
I was going to say, I bet he
They're
had a
they're like,
line.
running out of products. It was like, and so I'm so thankful that you did this for us, Nathan. And I think he's coming on to our monthly members meeting
He
too.
is. He's joining
Yeah.
us for our monthly member meeting. And back to what you were saying, Trace, scope of practice. It sounds to me like I have enough information here today to say I, as a dentist, can recommend nitric oxide production
100%. Yes.
just for the oral microbiome aspect. And then there are all these amazing side effects of health, right?
Yeah.
So I'm not treating your Alzheimer's. I'm not treating, I am
Yeah.
helping improve your oral microbiome. And what cascades from that can be a lot of amazing things, just like what we do with craniofacial development. We're doing dentistry, and there can be side effects of improved breathing and sleep. And not necessarily that we're saying you're going to have that, but there
Right.
could be.
Yeah.
Yeah.
Well, I'm excited about in working with the dental community on trying to eliminate the things that are disrupting nitric oxide production because I advocate give the body what it needs, let the body do its job, right? And so we have to stop doing the things that inhibit nitric oxide production and provide safe alternatives. Like, I think our toothpaste and our mouth rinse is going to be a game changer in dental medicine. And I think we've got, the ADA behind us. We've got a number of, innovative dental medicine practitioners like you guys that understand this, that see it, and can start to make, small steps that are going to have a profound effect on human health.
Well,
You just
I know. Oh, sorry,
Okay.
Trace.
So Stacy, what we do a lot of in the dental practice is, Nathan, I don't know if you're familiar with the Bale and Donine with the heart attack, beat the heart attack gene. So as dentists, we can do salivary testings and look at different the microbiome, the bacteria levels. And so I'm excited to use this on those patients that have a lot of, they're resistant to therapy. But yeah, I think that it's that's
Well,
amazing.
that's what we need. I mean, we need data and we need
Yeah, I'm
dentists
going to start
to
doing
help
that
us
for sure.
collect data in their patients. Because I'm confident when we've seen this anecdotally, but the metric is controlled clinical studies and select patient populations that are resistant, and those are the ones that we want to go after, the ones that are difficult to treat and manage patients.
I know you have a hard stop. You are one busy man. I would love for you to take a minute and talk about your book that's coming out. You
Yeah.
have like 100 bazillion interviews, TV interviews lined up. Those of you that can't see what he's holding up, go to our YouTube channel and you can see what he's holding up. But what's the title of your book and when can people and how can people order it?
It's called The Secret of Nitric Oxide, Bringing the Science to Life. And in this book, this has been a 2-year project where, to kind of chronicle the discovery of nitric oxide, what it is, what it does, bring awareness around nitric oxide, but really it's part autobiographical. Kind of my personal journey through this, how I got involved in the research, the discoveries we've made, and how we've been able to translate that basic science into clinical practice and functional nitric oxide product technology in every major product category around the world. So the book is going to launch officially on February 24th. I think I've got 34 live TV interviews lined up that day, starting at 6 a.m. all the way to 4 p.m. in every major market around the world. So you can find it wherever books are sold, Amazon, Barnes and Noble. If you go to nathansbook.com, we've got links to the pre-sale of the Kindle and the hardback. But yeah, I'm excited about it. I think it's, my motivation for writing the book was to kind of correct the ship and really correct all the misinformation out there and give patients, practitioners, really everybody, an awareness around nitric oxide based on real science, so that they can make informed decisions, informed consumers make informed decisions that can impact their health.
Trace, did you have a comment before I go into my rapid fire questions?
No, go into that. I'm just like, I'm gonna send you an email, Nathan, to see like if I can we can be like providers in the office to sell the product. Because I think that's where it is. Like we just I always like to make products accessible to patients versus like
Yes.
giving them the link to buy. So it's really nice that while we're doing the therapy with our patients, we're like, here, test this out. 60 days is great. Amazing.
Well, Nathan, here we go.
Okay.
3 life-changing questions here. 1, are you an early bird or a night owl?
Now, I'm an early bird. I've been that way my entire life. And it's, my wife and kids sleep late, and it's something that I've never been able to do. I'm up at 5:30. This past week I'm up at 4:30 trying to get the galley proofs in. And yeah, I'm up before the sun comes up. It's definitely an early bird.
So you're the kind of guy who gets more done by 9 a.m. than most people do the whole day.
No, that's right. I mean, from
Yeah.
like 5 to 8 o'clock is my time to really get the work done, because 8 o'clock business starts and there's so many distractions that if I'm going to be productive, I wake up early. I sit in my infrared sauna for 30 minutes. I open up my Hallow app. I do my prayers and, practice gratitude and
Love it.
start my day.
I love that whole thing right there. You just, that's why I believe very much why you're so impactful. You got a mission behind you that goes deeper than the research, I believe. What's your go-to comfort food?
My go-to comfort food. I'm a rancher. I'm a beef raiser. I've got, a couple hundred head of cattle on 800 acres, and we raise our own beef. But, there's nothing better than a good ribeye steak that's homegrown, that's free of antibiotics and hormones. And I know where that calf came from. I know what I put in them, and that's my go-to.
That's a good one. That is a good one. And last, what is your favorite vacation destination? Where do you go for a complete overhaul for your mind, body, soul?
I go to the beach, and I think I'm a true believer in this connection with nature. And, I go to South Florida a lot, a couple times a month. In fact, I'm headed there later today, but I stay on the beach. I wake up in the morning, I watch the sun come up on the east, and I put my feet in the sand and walk along the surf and get those electrons, and, it changes my voltage and just allows me to completely reset and re-energize.
I love it. Nathan, we appreciate you for taking the time to be with us. You're a busy person. You are changing the world, my friend. And we are honored that we get to have a glimpse of what's to come. And we can say we knew you when.
Thank you guys for all you do. You're certainly
Thank you,
changing the world,
Nathan.
especially in the pediatric population. But
Thank you.
thanks.
Appreciate
It's
that.
an honor and pleasure to know you and be able to work with you.
Thank you so much. All right, everybody, we'll see you next time. Thanks for joining us. This podcast would not be possible without the inspiration of my dad, Dan Becker, and creative direction and editing from the talented Jason Becker, Benjamin, and Judah Walker. To stay connected and keep the conversation going, be sure to subscribe to our podcast and visit our website at asappathway.com. And remember, the information in this podcast is for educational purposes only. It's not intended to be used as medical advice to replace your healthcare provider's diagnosis or recommendations.